So hi everyone, I'm Juliane. I'm presenting for Team 5. We chose one of the beautiful paintings upstairs as a group picture for no particular reason. We worked on, now I have to check this. We worked on Paul's challenge, which was on looking at advanced technologies to improve treatment, personalized treatment and diagnosis in regards to precision medicine. So the general idea of our challenge solution was to come up with a device or an app that would look at a couple of issues that we thought were limitations to the field of precision medicine. One being that there is a large amount of data already available through consortia, but we're not collectively looking at these, we're not applying them to patients, and they're not accessible to general practitioners. So how can we use this to more precisely define a patient's insulin sensitivity for better therapeutic choices? The second one being that we cannot disregard lifestyle factors. General practitioners largely rely on self-reported information from the patients, and they're mostly inaccurate, so how can we circumvent that? So we came up with the idea of providing a lifestyle app to patients that would monitor not only physical activity, but also diet or sleeping patterns, as well as smoking habits, just to provide a holistic behavioral picture of the patient. We're using this technology under the assumption that in the near future, omics data will be available for individual patients, so that the genome, the metabolome or epigenome, together with already established clinical markers that are predictive of diabetes or such, will be available for a single patient. So that when the patient approaches a GP, the GP will be able to feed these data into a diagnostic app, which will perform a scoring system according to any of these factors, together with the lifestyle data that the GP obtains from the patient. So the combined score will provide information on the patient's insulin sensitivity, as well as on the risk of developing diabetes. And most importantly, it will subgroup and classify the patient as to whether or not he's more likely to respond to one intervention or another. This can be exercise, this can be diet or drugs, or any combination of the above, where each of these components, of course, can vary as well. One patient may be responsive to sulfonylureas, another one may be more responsive to metformin. Excuse me. So the beauty of this system is that any of the data that we collect will feed back into our database, so that we continuously improve the precision of our diagnostic app, as well as the prediction of the best therapeutic treatment for the patient. Another advantage is that for the lifestyle app, the technology is already available, mostly available. We're just applying it to the healthcare system. So that also when the GP assigns a treatment, we can actually go back to the app and monitor whether the patient adheres to the recommended intervention. So because we want this to be integrated into the healthcare system, we'd like the government as well as the healthcare system to invest into such technologies, ultimately to reduce healthcare costs as a give and take approach that we would like to see in the future. Of course, there's limitations to this. Legal issues, obviously data safety, particularly for the patients. How are we going to standardize such procedures internationally? Different policies apply to different countries. In addition to what I've mentioned before, we also need the infrastructure to handle the data as well as process the data bioinformatically, as well as store the data. So in summary, we have a two-way system that with very little effort of the patient provides very important data to the GP, who can more precisely perform a diagnosis and assign a more personalized therapy to the patient into a dynamic system that will continuously improve in terms of precision. Thank you.